medical for women. I'm trained gynae microvascular surgery along with oncology surgery, breast cancer surgery along with plastic repairs, gynae and high risk obstetrics. I do practice gynecology, all forms of gynecology surgery and infertility, as well as gynae oncology. And my hobby is a little diverse than what I'm into it. Now, medical as a medical administrator, I've done lead auditor courses as well as NABH lead auditor, as well as I do practice to be in the highest form of medical form. I have done black belt, Six Sigma, lean practice. I do, and I'm a lead auditor for certified quality assessor also. And to be like ice in the cake. It is just like I've done my advanced finance management from XLI Jamshedpur. It's the most reputed country in the institution in the world. Basically, what I need to do, I need to be perfect in my job, and for that, those things I did all these things. Today, I really want to thank Dr. Mrs. Nanaware as well as the whole Baby Chakra team just to allow me to speak on a very fertile and a very vulnerable topic, which is preconceptional preparation of any newborn couple. After I'll give a 15 minutes here, then we can go for an open discussion. So basically, what is pre-counseling or preconceptional counseling? And it is always done by a nurse or a doctor just before you want to become a mother. See, would-be mother is a big job, and we need to understand the would-be mother should be well equipped with knowledge how to become mother. So basically what we do as in USA and all these things, see, it's basically we assess the biomedical aspect of the lady, behavioral and social risks associated with the woman's health as well as pregnancy outcome through prevention and management. This is what we need to do. For the moment we see the patients, all these things are there, all are cleared, we allow them go ahead with the pregnancy and as you want. So see, we need to understand one thing very carefully. Preconceptional stage is such a state, and it should be very stabilized state where you can have the best child. See, nowadays we have only one or two child, so that we need to be the best one in this world. So for that, what happened? We need to prepare as a mother, would-be mother, or as a would-be father. We need to make ourselves very omnipotent or potent enough to have the best ovum to be fertilized by the best sperm. So see, basically what we have seen, statistically 38% of all pregnancies are basically unplanned, whereas in India it is more than 62%. All the pregnancies are unplanned, and for this reason many gynecologists recommend that all women childbearing age should be offered a preconceptional as well as counseling regardless of intent to become pregnancy, because in India still we have in the very primitive stage of doing a preconceptional counseling. Basically the objective of this noble cause is only one thing: how to get the best child from the pregnancy. So first thing we need to always understand, for counseling part we need to have a very caring heart and a healing hand. This gives us the strength. See, basically counseling recommends 2-3 things, like we take the height, weight and do the BMI calculation, we take BP, blood pressure, medical history, as well as abdominal and pelvic examinations are done thoroughly. Rubella screening is done, varicella screening is done, domestic violence screening is also should be done, because of if the mother is not, if the girl is not being fed properly, she might not get the best ovum. And then we need to see all those things, depression screening and all these things, and test for gonorrhea and chlamydia and all the women who are at risk of high risk sexually transmitted disease has to be seen properly. So basically, what does this preconceptional consent? This preconceptional risk assessment for any potential complication during pregnancy, as well as the modification of risk factors such as increasing folic acid intake to reduce the risk of neural tube defect, as well as counseling for smoking, cessation, alcohol, or any alternate medicine which may be required to compromise the fetal development. Basically, I'll go in very fast and very brief way. See, basically, folic acid is such a medicine which is required in a normal low risk mother as 0.4 milligram per day, And for a high risk mother, we need to have 5 milligram per day for beginning 6 weeks prior planning for a pregnancy. So routine testing for rubella, IgG antibodies has to be done, hepatitis has to be done, vaccination needs to be completed for rubella as well as hepatitis B. So, and most of the time we need to rule out HIV, all the reproductive tract infections, STDs has to be ruled out. We need to avoid teratogenic drug before planning for pregnancy, and out of fear of pregnancy, it is like basically we try to avoid all these things and try to hide to our doctors, because first thing, always we need to understand one thing, that we need to be very open to our doctors, and our doctors are the best friends and they are the best people. They need to give us the best thing what we deserve, and moment we deserve the best, we get the best. For that, we need to be very truthful to our physician or gynecologist who will be treating us. Like taking iodized salts. If the patient has a history of thyroid, or patient is suffering from a diagnosed hypothyroidism, we need to exclude, or we need to see the status of all these things before conceiving. Like pre-existing chronic diseases like hypertension, diabetes, epilepsy, all needs to be like seen. Optimal state of intervention has to be attained. And again, to reiterate, caring heart with healing hands must to be there behind the pre-planning mother. Type 2 diabetes, or if the history of diabetes is there in the family, all needs to be assessed. And because we should understand this, type 2 diabetes or any history of maternal diabetic status leads to perinatal mortality, congenital malformation, preeclampsias, birth traumas, and operative deliveries. So again, coming back to hypothyroid, what happens? It reduces the fertility. It increases the chances of spontaneous abortion. See, first thing we need to understand, many a patient, they have got false notions. Sir, I am not conceiving. मैं बच्चा नहीं धारण कर पा रहा. It's not that. See, we should understand first, with fruitful 100 conception, only 15 crosses 3 months. So what happens to the rest 85? They all die off like that. And they feel, patient as a patient, she feels that I didn't conceive. It's not that she didn't conceive, but it is that because of all these problems, your sperm and ovum was not good, so that we didn't have a proper the best child or fertilization. Hypothyroid increases the risk of abortions. It increases the risk of fetal impaired brain development. So all these things needs to be understand. And if the patient is having a history of diabetes and all these things, blood sugar as well as HbA1c has to be near normal or less than 6.5. Again, diabetic or pregnancy guidelines also has to be understood in detail for any would-be mothers. Doses has to be prefixed. Sit with a gynecologist and a diabetologist so that you get the best quality egg, even though you are suffering from diabetes. And along with diabetes, we need to need to see one thing: sufficient glycemic control. Any other medical complication needs to be controlled, or any other extra things like smoking. Preconceptional counseling has a very great role in asking the patient to leave smoking or drinking or social drinking. See, many people, they have got now a style of calling, I'm in a social drinking form, but that leads to malformation of child as well as early and repeated spontaneous excuse me, abortions. So preconceptional care of women is of dire necessity, because to get the best child from the best mother and the father, and we had been under control. Like for diabetes, complications like retinopathy and all these things, retinopathy and everything. See, diabetes is such a dirty deficiency, which it attacks everything from brain till toe. Even genitalia also, it doesn't leave. So we need to have a very good control, so that we need to have the best child and the best ovum and the best sperm to fertilize each other. Satisfactory control of blood pressure is also be seen with patients who are having hypertension or history of hypertension. Hypertensive agent, if she is using, we need to change. and we need to like adopt medicines with like methyl dopa, labetalol. All those things has been in use right now. So patient with hypertension and all, we need to switch over to safer drugs like labetalol, methyl dopa, hydrolizine. So many things are there. So again, if a patient having a history, even though it is a subclinical or like patient they fail to understand, but we understand that subclinical, so we need to rule out systemic lupus erythematosus or rheumatoid factors along with it. So all this thing increases the adverse maternal as well as fetal outcome. So we need to be very clear, as well as preconceptional renal function has to be noted, as well as liver function has to be noted, and we need to level the patient in which category the patient lies, so that we need to know that which group of medicines we need to give to her so that we get the best baby out of it. Always we need to use thumb rule for anything, for even hypertension, chronic diseases like chronic renal disease or kidney diseases, diabetes, because all these things leads to growth restriction, oligohydramnias, renal dysplasias, fetal with renal failure, deaths. Many things happens, and we need to understand. See, all these AC inhibitors and angiotensin receptors, the blockers, they all lead to some or other like vascular as well as congestive, arterial diseases like thing. Best thing, get the proper evaluation done. Meet a doctor who suits your tastes. Any obesity is also has become a very common disease nowadays. Obesity, if it is there, use of fibrates and niacin and all these things, uh, give doctors, they commonly prescribe. Before prescribing anything, first thing we should take advice from obstetricians, so that they'll let us to know that when you're planning to go for pregnancy, if you're planning for pregnancy, don't go for all these things, so that we need to stop or we may get a bad child. Again, coming to CNS problems like seizures and all this, which are so common, doctors they generally advocate to take safer drugs like valproate and carbamazepine. But during pregnancy, we need to switch over to more safer drugs which are there with us, along with folic acid supplementation. So basically, another very dreadful disease is rheumatic heart diseases with patient planning for pregnancy. We need to see all these things beforehand, before conceiving a patient, like switching over from like warfarin to heparin if the patient has replacement surgeries. So many things are nowadays very common to see. So basically, what we need, a caring hand and a healing hand, to see that we don't have a recurring pregnancy losses, and the mother, they are in the safest hand, along with congenital problems or blood dyscrasias or blood from blood cancer diseases, or blood minor form of disease like thalassemia, sickle cell anemia. All needs to be detected beforehand, before planning for any because the moment you detect this after conception, we may lose the child, because nowadays we don't have that much, and everything is costly, nothing comes free nowadays. So when it is costly a thing, we need to see that everything has to be scored, everything has to be seen very detailed, and a doctor is always there to help you in doing all these things. And like many surgeries are there, like genital surgeries and all these things, only we need to correct those surgeries which allows the sperm to reach the cervix. Like if vaginal stenosis is there, or septum is there, we need to do septoplasty and all these things. It's a very easy operation nowadays. But uteculoplasties and all those things are a little rarer now. I don't know how many doctors they do, but I do it regularly here, because we get a lot of like biconjugate uterus are not conceiving for another 5, 6, 7 years, and biconjugate uterus generally they don't allow for IVF also, so patients they suffer, so they need a little bit of surgical aspect. Main thing always is that conceptional care is the most crucial during obstetric portion or obstetric history of any female in their life. Thank you very much. Now I just want to go ahead. I think we are through, and now we'll take up exams questions. See, both partners should be very carefully assessed to see the status, medical, surgical, and where they stand. If any endocrinal problems like diabetes, thyroid, all these things has to be addressed. And what are the this very nice questions he has asked? What are the questions to avoid as first time mom? See, things we need to avoid is drinking, smoking. See, those are or taking drugs. See, these are all common like drawback nowadays in our day-to-day life. Then asking even husband not to smoke, because passive smoker is the worst patients than active smokers. So these are the things we need to avoid. And traveling, see, for as far as traveling is concerned, see, the moment the patient responds or reacts to or comes to a doctor will do ultrasound. It's a very common thing in each and every obstetrician. Now they have ultrasound in their own chamber, so they will see if the low lying placenta is there, then we try to give restrictions to their movement. But if the patient nidation or what we call as a implantation is in a proper or higher in the fundal state, we don't need to give any much restrictions for anything. Yeah, any other question, ma'am? See, for any first time present, first thing always we need to see that how to get the best child. Medical history, surgical history, sitting with your doctor, your obstetrician, give them time. Then comes after you conceive and after you deliver, then comes the second portion. The second portion is more important, because how the mother needs to take care, because see, mother breastfeeding has to be done. No father can supplement those things, so mother has to be supplemented or helped by parents, and the father needs to know all these things: how to change nappies, what is the best way to change the nappies, how is the best way to clean the breast so that baby they have a proper and a healthy breastfeeding. All these things needs to be discussed. That is why you need to have a doctor, you need to have a obstetrician who will be there always to be by your side to help you and to lead you all these things. Changing nappies, changing even the first 15 days there will be a bleeding portion, so how to change this and paths, so many things. And she may require, because she might not be able to bend down, she might not be, because if she has episiotomy or if she have a bad tear, that may lead to even motion problems. So a husband, would be husband or first time husband, they need to take care of so many things. So we need to support uh, all the things to safeguard the mother first. First thing we need to always understand, the mother is the first thing we need to save and give them the best comfort, as a doctor, as an obstetrician, or as a husband, or as a mother. We need to save. That's why we always prefer to have a first pregnancy or first delivery in the mother's place, because mother can understand the daughter best. Thank you very much. And I think, like, if any other questions are there, you can get me in WhatsApp also, or any other form.